Hello everyone, my name is Enrique Grande, I am medical oncologist. I'm working at the Ramon y Cajal University Hospital, which is one of the largest hospitals that we have in Madrid, the capital of Spain. We presented at ASCO a phase 4 trial in which we assess the efficacy and the safety profile of enzalutamide, an anti-androgen blocker in metastatic castration-resistant prostate cancer, who have previously failed to abiraterone. We know from different retrospective analyses that probably there is a cross-resistance between abiraterone and enzalutamide. This is the first prospective trial in which the efficacy of enzalutamide has been assessed prospectively in patients who have already failed to abiraterone. We recruit 214 patients with metastatic castration-resistant prostate cancer who previously received abiraterone. 1/3 of these patients did receive also docetaxel previously to abiraterone. So all the patients were treated with enzalutamide after failure to abiraterone. So let's say that this is a really heavily patient population that clearly reflects the real life, the real patients that we are visiting in our practice. More than 60% of the patients were older than 75 years old, which clearly reflects the reality in our consultations, in our daily clinical consultations. The primary endpoint of the trial was to assess the radiographic progression-free survival rate. 8.1 months was the median radiographic progression-free survival that we achieved with enzalutamide after failure to abiraterone, which clearly matched with the median progression-free survival found in the AFFIRM phase 3 trial with enzalutamide that gave the approval for the drug after failure to docetaxel. Moreover, 26% of the patients, something like about 60-something patients, had a clear reduction in the PSA levels in the blood of the patients. So more than 25% of the patients had a reduction in more than 50% in the levels of the PSA, which is a good clinical benefit in terms of the activity of the drugs. The median PSA progression-free survival was about 5.6 months, which is in line what we can expect from the drug after failure to docetaxel. And probably the most relevant thing is that the safety profile of enzalutamide clearly matched what the expected side effect profile that we have from the drug from previous trials. So as a conclusion, in more than 200 patients prospectively treated with enzalutamide after failure to abiraterone, we can say that in some patients, enzalutamide is still important and clearly affects to the efficacy of the drug in patients with metastatic castration-resistant prostate cancer who have already failed to abiraterone. The median radiographic progression-free survival that we observe in our patients treated with enzalutamide was more than 8 months, which is clearly relevant from the clinical practice. 26% of the patients achieve a reduction in the PSA levels, which is clinically meaningful for our patients. What is the clinical impact of this data? Well, we can say that the cross-resistance that we are all heard about between abiraterone and enzalutamide and abiraterone is there, but there are some patients that can still receive a clinical benefit to be treated with an anti-androgen inhibitor after failure to abiraterone. Thank you so much.